Good morning, one and all of you. My name is Rasne Somnath, lecturer from Pravara Medical Trust, College of Pharmacy, Shogo. My subject is pharmacology and toxicology. In previous lecture, shown that itocoids point that containing histamine and 5-hydroxytryptamine. Today we will be the discuss to hear that having a new point that's the name is cardiovascular drugs. Cardiovascular drugs, and that point or that unit contain about 5 to 6 chapters. These cardiovascular drugs unit consist about the 5 chapter like that. First is Digitalis and related cardiac glycosides. Second is that antiarrhythmic drugs, then antihypertensive drugs, then vasodilators and antianginal drugs, and last is that to this unit is drugs used in atherosclerosis. These points are discussed in this unit. So today's lecture ongoing to that Digitalis and related cardiac glycosides. Digitalis, these are the cardiac glycosides, and another to that study about related cardiac glycosides. One by one discuss here about the firstly introductory part of Digitalis and related cardiac glycosides. The term cardiac glycoside refers to a group of chemically related drugs which have a specific action on the heart. These cardiac glycosides are the chemically relating to that drugs and which having a specific action on the heart. These cardiac glycosides are the used or digitalis, they are used for the treatment of congestive heart failure. The congestive heart failure, it's also known as CHF condition. These are a chronic condition in which the heart does not pump blood as well as it should. That's called as, or that disorder or that disease or that condition called as the congestive heart failure. Heart failure can occur if the heart cannot pump systolic or diastolic adequately, and that condition called as congestive heart failure. And these digitalis and related cardiac glycosides are the used for the treatment of congestive heart failure. So these are the introductory part of the congestive heart failure. Then next slide shown that sources of cardiac glycosides. The various sources of the cardiac glycosides are available. It's also available on the animal and it's also available in the plant. The cardiac glycosides are obtaining from a number of plants. These cardiac glycosides are obtaining from the number of plants. They are firstly digitalis, which has a 2 species. Digitalis containing about the 2 mainly species, like namely D. lanata and D. purpurea. D. lanata and D. purpurea, these are the 2 species of digitalis, and they contain the cardiac glycosides digitoxin and gitoxin. These digitalis species contain the 2 chemicals like digitoxin and gitoxin. These are the chemicals are present in the digitalis species, namely D. lanata and D. purpurea. Second source of cardiac glycosides is that Strophanthus. Strophanthus, these are also having a plant and that's having a 2 species like that name S. gratus, and that S. gratus species containing G. Strophanthin chemicals and S.kombe containing the k-strophanthin chemicals. These are the second source of cardiac glycosides. Then third source of cardiac glycosides are the squill. It's also having a plant. A squill is a liliaceous plant and that containing the proscillaridin, and that plant contain the proscillaridin chemicals. Certain other plants like Thevetia, nerifolia, Nerium, oleander, and Convallaria majalis also contain cardiac glycosides. This is also having a plant containing the cardiac glycosides. The one animal source is Bufo vulgaris, a toad, and which contains the cardiac glycosides, and the chemical name is that bufotoxin. This is the animal source of cardiac glycosides. It's available from the Bufo vulgaris and it's are used for the congestive heart failure or the treatment of congestive heart failure. So this is the sources of cardiac glycosides. Then next, chemistry of cardiac glycosides. That glycosides or cardiac glycosides contain the various benzene ring or various chemicals are the present. One by one discuss. These cardiac glycosides containing sugar portion and non-sugar portion are the present. These cardiac glycosides containing the sugar portion and non-sugar portion, and that is called as the normal sugar portion is called as a glycon or genin. The normal sugar or absent of the sugar, it's also known as a glycon or genin. The glycon has a steroid structure with lacton ring attached to the 17th carbon atom. The glycon, especially the lacton ring, is responsible for pharmacological action. यामध्ये जी काय लॅक्टॉन रिंग प्रेझेंट आहे कार्डियाक ग्लायकोसाइड्समध्ये त्यामध्ये 17 पोझिशनला जी काय अटॅच झालेली आहे कार्बन ॲटम ह्या पोझिशनमुळेच ह्या रिस्पॉन्सिबल फॉर द फार्मॅकोलॉजिकल ॲक्शन ऑन द हार्ट. सो द शुगर पोर्शन जो आहे जो काय अग्लायकॉन पोर्शन आहे नॉन शुगर पोर्शन that's having a responsible for the pharmacological action, but that sugar portion it's only portion to help in the permeability, penetrability and fixation of the cardiac glycosides on the myocardium. The aglycon portion of the cardiac glycosides it's having a lacton ring attached to 17 carbon atom, and this ring is responsible for the pharmacological action, but the sugar portion help in the permeability to transfer from one portion to another, penetrability and fixation of the cardiac glycosides on the myocardium. This all about the chemistry of cardiac glycosides. The cardiac glycosides are the structure as a steroid structure, which like that steroid structure with the lacton ring are the present that having attached to the 17 carbon atom ring. This is all about the chemistry of cardiac glycoside. Then next slide shown that action of digitalis. There are the two actions of digitalis. One is cardiac action and another is the extra cardiac action. The cardiac action containing cardiac contractility. The digitalis increases the force of systolic contraction of the heart muscle. These digitalis are the administration that have increases the force of systolic contraction of the heart muscle. Also, it decreases the duration of systole. Also, it having the decreases of duration of systole. The duration of the time of systoling is the decreases by increasing the force of systolic contraction. So, in a limited time, the heart contract powerful, leading to complete ventricular emptying. Digitalis raise oxygen consumption of heart to normal. It does not increases the energy production by cardiac muscle but improves the energy utilization. So the digitalis heart can do more work with less energy, and this improves the efficiency of heart. This is the cardiac contractility on action on digitalis, action of digitalis on the heart on cardiac contractility. So next slide is showing that heart rate. In heart failure, the heart rate increases as a compensation for reduced output. It is also because the ventricles is excited even by weak auricular stimuli due to lower threshold. Digitalis reduce the heart rate by the following mechanism. These digitalis having reduced the heart rate by the following mechanism. There are the three mechanisms to reduce the heart rate. Ventricles do not respond to weak auricular stimuli. Second, refractory period of ventricle muscle is prolonged. And third is depression of conducting tissue, which reduces the passage of auricular impulses. Refractory period, it's having it is a period of diastolic. It is a period of time during which the cell is incapable and repeating the action of potential. That's called as refractory period. These three mechanisms are by using to digitalis reduce the heart rate by this mechanism. Then this slide is showing a vagal and extravagal effect. Small dose of digitalis produces cardiac slowing due to stimulation in large doses. It is due to prolongation of refractory period. Then another action of digitalis on conduction system. Conduction system, digitalis depresses the conduction system directly. This digitalis glycosides, it's having depress the conduction system directly. Also, the refractory period is increases and the conduction rate is slow. It's also having the digitalis glycoside increases the refractory period and conduction rate is slow. And this is shown as an increases the PR interval in electrocardiogram. That's the conduction system goes on digitalis, that's having refractory period increase, that's to that conduction rate is slow, and then show increases the PR interval on in electrocardiogram, means ECG. This is the effect of digitalis on a cardiac action on a conduction system. Then next, cardiac size. Digitalis decreases the size of both normal and falling heart. Digitalis decreases the size of both normal and falling heart. In heart failure, digitalis returns the size of enlarged the heart to normal. This increases cardiac output, and in normal heart, digitalis decreases the size and hence cardiac output is decreases. The digitalis on cardiac size वरती काय इफेक्ट दाखवत असेल, to that having a effect on a digitalis decreases the size of both normal and falling heart. नॉर्मल हार्ट किंवा फॉलिंग हार्ट जे आहेत, फेलिंग हार्ट, त्यांच्यावर कार्डियक साईज डिजिटलीचा काय इफेक्ट होत असेल तर डिक्रीजेस दी साईज ऑफ बोथ नॉर्मल अँड फॉलिंग हार्ट. इन हार्ट फेल्युअर, जर हार्ट फेल्युअरचा प्रॉब्लेम असेल तर त्यावेळेस डिजिटॅलिस रिटर्न्स टू द साईज ऑफ एनलार्ज हार्ट टू नॉर्मल. धीज इन्क्रीजेस दी कार्डियक आउटपुट. In normal heart, digitalis decreases the size and hence cardiac output is decreases. Then cardiac output. Digitalis decreases the cardiac output in normal heart. Digitalis decreases the cardiac output in normal heart, and this effect is due to reduction in size. In falling heart, digitalis increases the cardiac output, and this effect is produced due to return of heart to normal size, increases the force of contraction and complete the cardiac emptying time. This also having a cardiac output on a digitalis. This all over the pharmacological action or cardiac action on heart. Then second, extra cardiac action on kidney. The first prominent manifestation of the effect of digitalis in edema is diuresis, and this is due to decreases in venous pressure, in which shift the edema fluid into circulation. And second is the direct renal action, inhibiting the reabsorption of sodium. Then next slide, gastrointestinal tract. The digitalis, its effect on GIT tract. In toxic doses, digitalis produce nausea, vomiting and diarrhea. The emetic effect is due to direct irritation of gastrointestinal tract, and second is the stimulation of chemoreceptor trigger zone, means CTZ. So digitalis effect on GIT tract is produces that nausea, vomiting and diarrhea because its irritation in GIT and stimulation of CTZ or chemoreceptor trigger zone. So the next slide, absorption, metabolism and excretion of the digitalis. Digitalis is adequately absorbed from the intestine. Subcutaneous or intramuscular injection is unreliable and it may produce local irritation, swelling and abscess. It is bound to plasma albumin. High concentration is found to the heart. It is eliminated very slowly through the kidney. So, it is likely to produce cumulative toxicity or appear. This is the absorption, metabolism and excretion of digitalis point. The next slide is that adverse reaction of the digitalis. Digitalis, its effect on GIT tract, firstly gastrointestinal tract, that having produced nausea, vomiting and diarrhea both on oral and parenteral administration. This is due to irritation of GIT tract and stimulation of chemoreceptor trigger zone. Then cardiac toxicity. Digitalis produces all type of cardiac arrhythmias like atrial tachycardia असेल, atrial flutter असेल किंवा atrial fibrillation, ventricular tachycardia. हे सर्व ventricular flutter and ventricular fibrillation. These cardiac arrhythmias occur due to disturbed impulses formation or disturbed impulse conduction by using this digitalis drug. जे कार्डियाक टॉक्सिसिटी भरपूर प्रमाणात होत असते ज्यावेळेस डिजिटलिस ड्रग आपण घेत असतो त्यावेळेस. बट विच डिजिटलिस आर द यूज इन द कंजेस्टिव्ह हार्ट फेल्युअर. तरी पण कंजेस्टिव्ह हार्ट फेल्युअरसाठी डिजिटलिस इज द बेस्ट मेडिसिन और ग्लायकोसाइड्स. But that having digitalis, it produces all type of cardiac arrhythmias. Then another adverse reaction is the blood coagulation. Digitalis increases the coagulability of blood, so it is likely to produce thromboembolic complication. Digitalis, it's also having increases the coagulability of blood, and so that having to produce thromboembolic complication. Then another adverse reaction is the ECG changes. They are shortening of QT interval and lengthening of PR interval and inversion of the T wave. म्हणजे जर डिजिटली जर आपण ॲडमिनिस्ट्रेशन केलं तर ECG मध्ये सुद्धा चेंजेस होऊ शकतात. जे काय QT इंटरवल आहे त्यांचे शॉर्ट होऊ शकतं, PR इंटरवल इन्क्रीज लेंथ होऊ शकतात आणि जी टी वेव्ह आहे त्यांचं इन्व्हर्जन होऊ शकतं. अशा प्रकारे चेंजेस ह्या डिजिटलिस ड्रगमुळे होऊ शकतात. म्हणजेच त्याचे हे ॲडवर्स रिॲक्शन आहेत. व्हिजनवरती काय इफेक्ट असेल तर डिजिटलिस प्रोड्युसेस व्हिज्युअल डिफेक्ट लाईक ब्लर व्हिजन अँड कलर डिफेक्ट. अँड लास्ट इज न्यूरोलॉजिकल सिम्टम्स. दे आर प्रोड्यूस हेडेक, फटीग, ड्रॉझिनेस अँड मेंटल सिम्टम्स. ऑल ऑफ दॅट ॲडवर्स रिॲक्शन और ॲडवर्स इफेक्ट ऑफ द डिजिटलिस ड्रग. Then next slide, preparations and dose. Digitoxin is available as tablets and injection forms. The initial dose for oral, intravenous and intramuscular administration is 1 to 1.5 milligram. The starting dose or initial dose for the digitoxin for the treatment of congestive heart failure by orally, intravenously or intramuscularly is 1 to 1.5 milligram. But then After that medicine taken, the maintenance dose is only 0.1 to 0.15 milligram daily. This is the dose of digitoxin. This is the dose of digitoxin, and another dose is a digoxin. Digoxin is available as a tablet and injection form. The initial oral dose is a 1 to 2.5 milligram, and for maintenance it is administration at 0.125 to 0.75 milligram daily. The initial intravenous and intramuscular dose is 1 to 2 milligram. The initial intravenous and intramuscular dose is 1 to 2 milligram, and the maintenance dose is 0.125 to 0.75 milligram daily. These are the digoxin medicine or glycoside, or this is the digitoxin glycosides. Then next is that therapeutic uses of these digitalis. Digitalis, it's for the therapeutic uses of digitalis. First use is that for the treatment of congestive heart failure. Congestive heart failure म्हणजे काय? That is also known as a CHF. It's a chronic condition in which the heart does not pump blood as well as it should. म्हणजे त्यावेळेस अशी कंडिशन क्या त्यावेळेस जे काय हार्ट आहे ते पंप करण्याचं काम त्याचं स्टॉप होतं आहे, स्वतःही तो पंप करत नाही ब्लड, त्यावेळेच्या कंडिशनला कंजेस्टिव्ह हार्ट फेल्युअर म्हटलं जातं. त्याच वेळेस ज्यावेळेस हार्ट फेल्युअर होईल कॅन ऑकर इफ द हार्ट cannot pump systolic or diastolic adequately, and that's to that ह्या सर्व कंडिशनला ट्रीटमेंट करण्यासाठी डिजिटॅलिस ड्रग किंवा ग्लायकोसाइड्स यूज केला जातो. देन टू कंट्रोल दी अरेथमियाज लाईक ॲट्रियल फ्लटर, ॲट्रियल फायब्रिलेशन अँड पॅरोक्झिमल ॲट्रियल टॅकिकार्डिया. म्हणजे काय तर हे जे काय डिजिटलिस आहे इट्स कंट्रोल टू दॅट अरेथमियाज. अरेथमियाज मीन्स इरेग्युलर हार्टबीट और improper beating of heart. Then atrial flutter, it's a condition in which heart upper chamber atria beat too quickly. Then atrial fibrillation, an irregular rapid heart rate that commonly causes poor blood flow. And last, atrial tachycardia, abnormal heart rhythm. This is the therapeutic uses of digitalis on heart. And last one also having a drug that's known as Amrinone. It is the bipyridine derivative. It is a non-glycosides. It is a non-adrenergic positive inotropic agent. The inotropic effect is additive to that of digitalis. It is useful in patient resistance to digitalis. बऱ्याच पेशंटला digitalis ग्लायकोसाइड जमत नाही किंवा सूट होत नाही, त्यावेळेस त्या पेशंटला ॲमिरिनॉन नावाचा ड्रग दिला जातो for the treatment of congestive heart failure or various to control arrhythmias. And thrombocytopenia is a common adverse effect. पण ह्या ॲम्ब्रिनॉनचा एक ॲडवर्स इफेक्ट आहे तो म्हणजे थ्रोम्बोसायटोपिनिया मीन्स ब्लड कोगुलेशन. दिस ऑल्सो हॅविंग अ थ्रोम्बोसायटोपिनिया आर दी प्रोड्यूस that having a Amrinone, it's a bipyridine derivative, are the using for the therapeutic use as a treatment of congestive heart failure. Thank you so much. Next point uploaded in next lecture, so thank you.